Now to coronavirus outbreak, which the World Health Organization has now declared a global health emergency. A hospital has confirmed the first case of person-to-person transmission in the U.S. The illness is blamed for more than 200 deaths in China, and the State Department now recommends no travel to that country. Nearly 10,000 cases are reported worldwide, including 6 in the U.S. Our lead national correspondent, David Begnaud, is in Loma Linda, California, at a hospital where doctors are ready to treat people evacuated from China this week. David, what are you learning?
Well, this is Loma Linda University Medical Center, and this is the emergency room entrance, but look what's right across from it. This tent that has been set up, they are using it. They've used it in the past for flu patients, but now they're using it to determine if someone might have the coronavirus. Once you come inside, you have the bed here, you've got some cots, just a triage area. And of course, the first thing they do is they check your temperature. Standard protocol if you're determining whether or not someone has coronavirus. Listen, this is the area where within the last 48 hours you had more than 100 Americans come via plane from Wuhan, China. They arrived here, and hospital officials said because they are here, let's mobilize our tent and prepare it just in case.
Anything that's in here that you breathe out will go out, and then fresh air comes in so that things aren't being exposed to the outside. If we didn't have the plane that came in, the reality is actually incredibly low that we'd actually have to use it.
This hospital is 11 miles away from March Air Reserve Base. That's where 195 Americans were flown back from Wuhan, China. They arrived here about 48 hours ago. They were asked to stay on the base for 72 hours. They're being monitored for symptoms. Ian Thompson is one of them.
This is behind me here is the facilities where we all stay. And then if you turn around this way, you can see there's the mobile facility over there.
I interviewed Thompson via Skype from outside the airbase. We couldn't get in, and he is abiding by requests from the local health department not to leave. Someone did try to leave yesterday, but was then told they could not leave, and a quarantine order was issued. Thompson, who lives in Michigan, says he's anxious to get home. You've been willing to keep in touch with us and update us. Other people aren't ready to talk. Do you know why?
They may be scared that their local area is probably going to get some negative feedback when they get back.
The first human-to-human transmission of the coronavirus in the United States has been confirmed in Illinois. It involves a husband and wife. The 60-year-old woman traveled to Wuhan last month. Her husband did not.
Public health officials are investigating locations where this second patient has visited in the last 2 weeks and any close contacts who were possibly exposed.
Worldwide, the number of cases is growing. The World Health Organization's declaration of a global health emergency comes as more than 20 countries are fighting coronavirus within their borders.
Our greatest concern is the potential for the virus to spread to countries with weaker health systems and which are ill prepared to deal with it.
Don't panic. That's essentially what the CDC said yesterday. I was on their call with a lot of other media members. They sounded clear, but they were calm in saying, listen, there will be more cases of the coronavirus. We expect it, but we're ready to deal with it. Jerika, the number one thing they said that everyone should know is, as of right now, the federal government does not believe that Americans need to wear masks when they go out in public. Not as of now.
All right, David Begnaud, thank you so much.